Let's talk about these peptides and GLPs and all of the good stuff that we are now doing. So I'm going to reconstitute and just talk to you about this process a little bit. I'll share what I know and then you share what you know in the comments. So what I've learned about these little vials is that the lid is both a lid and a seal, and they actually sell these lids without the seal, obviously, if you want them. However, the lids that come on them are attached to the foil lining, and it's actually a good practice to make sure that you're breaking that seal upon opening them. Okay, so it might be a little hard to remove, but that's fine. I have learned to use an alcohol pad and swipe once in one direction instead of in circles. So I open one pad, I use two sides, giving me 2 vials to have cleaned. So here's my syringe. I got these on Amazon. I will look for all of these products on here as well. I think these syringes and the alcohol pads are the only thing I didn't get on TikTok Shop. So a trick that everyone knows is to pull the stopper back to the amount that you want to withdraw. And then once you insert the needle in the middle of the gray rubber pad, you push the stopper all the way down as far as you can, pushing the air into the vial, and then you'll remove your finger from the stopper and the syringe will fill on its own. We'll talk about air bubbles later. I do just want to say, don't worry about it. So, this is what it looks like up close. Okay. As far as reconstitution goes, everyone knows 1 milliliter of bath water to 1 milligram of peptide. However, I have 0.5 milligrams of peptide bottles. So once you insert the needle into the vial, the pressure just makes the water automatically go in on its own. So you do want to remember to put the needle in at an angle and have it go towards the side. Okay. So if you want to help with the mixing process, you can roll it between your hands. However, I've noticed that all of the pressure that's inside of the bottle actually helps with the reconstitution. So you don't have much to worry about. You can just kind of set it to the side. Now, if you find yourself confused on which bottles are which because they look so much alike once reconstituted, inside of the vials of the backed water and the peptide tend to look different. So you'll see inside of that one, it was just round and flat. And in here, there's a glare, but in here, there's a space in between allowing you to push the needle towards the side for the reconstitution. So that's a good tip if you get confused. Also, always remember when inserting that needle, go for that circle. That's a place, that's a signal to tell you where to put the needle. You put it there. If you try to put it on the side, anywhere outside of that circle, you will likely bend your needle, especially if they are the thin ones. These are thicker, but if it's one of the thin ones, you're going to probably bend that needle. So we're going to go right into that circle. Just a quick preview. Going right in there, right in the middle, pushing the stopper in after placing it where we want it to be. I kind of knock those bubbles out of the way sometimes. You really want to toss it, turn it straight up and down, but here we are. And it filled up the syringe on its own. I'm double checking to make sure. Yep, sure did. I'm going to go ahead and pull it out. I see that air bubble. I'm like, I'm going to push that out. And I'm trying to push it and it didn't come out. And you just waste backed water. I did that just to show you. I've done that so many times before, trying to get the perfect vial, the perfect syringe, and you don't need to. Just use the water and worry about that part later. You don't want to use all your backwater. It's pretty easy to come by, but you don't want to use it all, right? And then just one day be like, dang, I got to order some more. I'm going to be late on this week's dosage. So, yeah, there's no need to waste it. So, yeah, now we're going to go ahead and fill our pen. So, this is my new cartridge. I took the old one out. I'm going to clean up my pen a little bit, and then we're going to talk about the stopper. So, basically, you see that gray stopper that's at the back of the pen right there. And that, again, this vial, this cartridge is also pressurized. So in order to be able to put something inside of it without it falling out of the back, we have to push the stopper in. Okay. So if we just started putting peptide in right now, it would fall out the back. Now, there are other ways to keep it from falling out, but just to be safe, I always do both. And by both, I mean I'm going to push that gray stopper in some because I can keep an eye on it if it starts going backwards and, adjust. And then I'm also going to use a venting needle at the same time. So to push that stopper in your pen, you're going to wind it up and then just use your thumb and push that button at the top of the pen in to push the stopper down. That's the same method you would use if you were doing an injection, just winding up. Now, in case you don't know, the numbers on the winder, I'll call it, match the numbers on the vial. So if you wanted to gauge how much you wanted to put in and do an injection, that's how you would know. So now we have the stopper of the cartridge moved out of the way. I'm going to show you how to vent. You're going to take your needle, your syringe, you're going to remove a plunger from it and put it in. Now that's going to allow some air to come out through that needle and through the tubing of the syringe when you put peptide in. Allowing air to leave, as I explained earlier, is basically just preventing the pressure of inserting the peptide from knocking the plunger out of the back of the cartridge. Okay, don't make that mistake. You don't need to make all the mistakes yourself because your peptide is going to be all over the counter. You're going to be like, I know you're lying. I don't know about you, but it took 2 weeks for me to get this. So now we're going to just go ahead and fill up our syringes, right? I just get every little drop as much as I can because, I noticed some running in the creases and crevices. I'm like, give me that. Give me that. So, I don't know why, but I feel like with this, it's just really a lot more simple. For some reason, I feel like the backwater doesn't act right until it gets mixed with the peptide, but maybe that's just me. So, anyways, to get that air out of there, I obviously push the plunger up. I turned the syringe upside down, pushed the plunger up until just a teeny drop of peptide came out the needle, and then I knew all the air was gone. And now here I am adding that syringe into the cartridge. Okay, so I did that over and over again, filled it up. That's pretty simple. Now I'm going to put the pen back on. Now there's so much air in there, so much pressure in there, I can't actually screw it on easily. I need to let some air out again because remember, this pen has that pusher that pushes the plunger, and I have to consider that. So I put on this needle top, which is what I would have on if I were doing an injection. And I put the pen together and I lose a little pep. Sorry. I lose a little pep. I turn it all the way upside down and get that air out. So now, storing. So I reconstituted an extra vial. How am I going to store this and not get it mixed up? Well, one, there's the cap trick I taught you. The inside of the cap looks different on the pep than it does the backwater. so I can look at that. Another is, obviously, once I put it in here and store it with other vials of Reta, it is going to be clear, and versus the unreconstitute is going to be white. But also, I'm going to put a little sticky date on there so I know when I did it. All right, lastly, we're just going to talk about trash. This is actually important. All of this trash is going to be remaining. For some of you, you may even use gloves. So we need to make sure we dispose of it properly. The biggest issue is going to be needles, syringes. You don't want yourself or your child to just be living life. You go in the kitchen, the bag's a little full, the trash can's a little full. You use your hand to push it down in there, and people are getting jabbed with needles. You don't want stray animals messing with their needles. You don't want homeless people, homeless children looking for food, and coming across your needles. You do not want that. You don't. These are very inexpensive, and these are called pockets. We're going to have to look at the box, but these are like little containers. This was a 3-pack of portable pocket sharps container. You can fit them in your pocket. You can put them in your car. You can travel with them. You can put them in your purse, whatever. You know what I mean? These are great for people with diabetes, I guess. At first I was like, what am I going to do with that little bitty thing? I need a big one. And then I realized, most syringes have screw off needles for this reason, I bet. So this is actually perfect and big enough to last me months, just one vial. So, one box, sorry. I really am glad I got this. So you can close it and open it, but then there's a lock feature, so it can't be opened. And I didn't realize that, y'all. So this one I accidentally locked after putting these 3 in there. Can't open it, which is good. That's what we bought it for.